There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: how can you keep your blood pressure normal? Answer by Kurian Padapananickal. First of all, I am no doctor and the following is no medical advice. As I understand, high BP is caused by A. Lack of enough oxygen, B. Enough nutrients, C. Stiff arteries, and D. Excess fluid. Ensure good air and proper ventilation. Feel breathing is also very useful. Eat nutrient-rich food. Moringa leaves are very useful for high BP. Take 10 milliliters juice for a week. Beetroots are very good to relax arteries. 7 milliliters of ACV or lemon juice for a month might decalcify the arteries. Do not take calcium supplements without vitamin D3, K2, magnesium, etc. Control sodium intake and have sufficient potassium. Have sufficient exercise. Normally the above take care of high BP. Consult a physician to rule out any medical condition. Answer by Rajinder Bala. About 13 years back, I was adding 1/4 small spoon of salt to every glass of water that I was drinking. In those days I used to drink about 8 glasses per day. My blood pressure used to be 120/80 or less in those days. After 20 months or so, my blood pressure shot up to 150/100s. I stopped adding salt to water. In about 1 month my blood pressure came back to normal 120/80 or less, so salt alone is not the cause. 13 years later my blood pressure is still 120/80. During that period other family members, my son, daughter and wife, also used to add salt to water. After so many years they have lower than normal blood pressure. My daughter's blood pressure is 90/55 and my son's blood pressure is 160. They have no health issue relating to low blood pressure. Now I will skip to hydration. Dehydration. Dehydration could be a way to normal blood pressure. However, it has to be a very cautious dehydration. It should be done somewhat like: Day 1, drink 200 milliliters water every hour from 9 a.m. to 6 p.m. Total 2000 milliliters water. No other liquids. Day 2, drink 1500 milliliters water 150 milliliters every hour from 9 a.m. to 6 p.m. Gradually widen the gap between 200 and 150 milliliters. After about 1 month make it 200 and 100 milliliters. Hope that it works. Beware that there has not been any conclusive study done in any country linking salt to high blood pressure. Answer by Bob McCown. Maintain a healthy diet, weight, exercise regimen. Don't smoke. When I worked for the US Army I heard from middle-aged fit healthy men all the time, how can I have high blood pressure? I'm fit. Exercise. Don't smoke. The answer was that their parents had high blood pressure. Universally when I asked, this was the answer: hypertension is mostly a genetic disease. The same can be said of type 2 diabetes mellitus.